everybody.
That's mine. Just don't want you to catch it, please.
Carol, come on down. Sharif, let's get a few more on this side.
No need to be quiet. You may applaud. Well, good afternoon, everyone. As you can tell, we are some very happy campers here in this room today. Today, as we gather for our annual ACA Partner Kickoff event, which we have held every year for the last 6 years, we are thrilled to welcome today Governor Murphy, Tammy Murphy, the entire team of the New Jersey Murphy administration here today, who are going to talk about their role in promoting the Affordable Care Act and connecting New Jerseyans to coverage. So a round of applause. We have finally gotten here. So for those of you who may not know, and forgive me if I forget anyone, in addition to Governor Murphy and First Lady Tammy Murphy, we have Commissioner Caride from Department of Banking and Insurance. We have Commissioner Carol Johnson from the Department of Human Services, Commissioner Sharif El-Nahal from Department of Health, Secretary of Treasury in New Jersey, Liz Munoz. Anybody? Oh, and right behind me, Senator Menendez and Congresswoman Bonnie Watson-Coleman. Yes.
Christine Norapaya, right?
Christine, I'm getting new. You know, we weren't allowed to talk to the state for many years, so this is a great new experience for us.
That's a Soviet.
In January, I and a few of our partners were on hand when Governor Murphy declared his commitment to taking the necessary actions at the state level to ensure that individuals who want to obtain health insurance through the Affordable Care Act marketplace would have the means and would be made aware of how and when to enroll. Understanding that state agencies are a critical point of contact for sharing information with the general public, Governor Murphy has committed to employing the resources of all of these agencies to promote the ACA and ensure New Jersey families understand the opportunities that are available to them. Today, we are thrilled, and I say that with every bit of passion that I can muster, to finally stand here in 2018 in partnership with the state of New Jersey. For 5 years, New Jersey's administration had been absent from the efforts to enroll people and state residents in the Affordable Care Act and quality health care programs offered by that law. So today we are very grateful, very honored to have with us Governor Murphy and his full administration putting their weight behind the outreach to ensure that every New Jerseyan can get connected to coverage. And without further delay, it is my honor to introduce to you Governor Phil Murphy.
Thank you, Maura. Hey, Maura, I think you took my remarks. Good afternoon, everybody. I want to talk about some of the folks up here with me, but I appreciate, Maura, all the very good words that you've sent my way. The guy to my left helped write the Affordable Care Act, Senator Bob Menendez. But having said that, I'll take it, Maura. Thank you, Maura, so much for that introduction. Thank you for your efforts and those of New Jersey Citizen Action. Where's Phyllis? Phyllis, you here? Phyllis is with us in spirit, if not here, and the whole team to ensure that every New Jerseyan has access to affordable health care. And thank you, everyone, for your commitment to this vital goal as well, and for taking time to attend this training so we can hit the ground running when the Affordable Care Act's open enrollment period begins on Thursday. It is such an honor to be joined by two of our most tireless fighters that I think I've ever met. As I mentioned already, Senator, the one and only, the singular Senator Bob Menendez, the senior senator from the state of New Jersey. Senator. And again, I remind everyone, if you think the Affordable Care Act is a good thing, he helped write it. And beside him, I don't know where literally we would be without her, but the one and the only Congresswoman Bonnie Watson Coleman. Yeah. We're in your backyard here, Bonnie.
Yes, you are.
Right?
Welcome here.
I love it. Thank you for the weather today as well. It is also a pleasure, as Maura alluded to be here with a big chunk of our cabinet, and they've got your back in this effort. Starting on the far left, the Commissioner of Banking and Insurance, who you're going to hear from in a few minutes, Marlene Caride. Marlene, always an honor to have you. You will also hear from Human Services Commissioner, the one and only Carol Johnson. Carol, thank you again for being here. To her side, Health Commissioner, who was working morning, noon, and night on some tough stuff these days, Dr. Sharif El-Nahal is with us. And Commissioner for the Department of Children and Families, Christine Norbert Beyer, to his right. And our extraordinary treasurer, Liz Moyle. Liz, honored to have you. And I must also pay homage to the First Lady of the great state of New Jersey, Tammy Murphy's in the house. It all kind of boils down to this. President Trump and his Republican enablers in Congress, who, by the way, we hope lose their jobs in 1 week from today. Yeah. I don't want to get too political, but they're doing everything they can to tear down the Affordable Care Act. We in New Jersey know better, and we are proving that the ACA works, and we are leading the fight across our country. Last December, before, in fact, I took office, I visited Citizen Action's ACA enrollment office on Halsey Street in Newark. There, I promised that New Jersey would be your partner to help you reach every eligible resident so we could enroll them for coverage. In my first week as governor, I kept this promise and signed an executive order directing our state agencies to work together to not only better advertise the ACA enrollment period, but to ensure proper coordination among departments and agencies so residents would know the options available to them. Then I proudly signed, a few months later, 2 laws that strengthened and protected our health insurance marketplace. And guess what? After having done all that, last month we announced that because of these efforts, ACA premiums would actually decrease for the next plan year by almost 10%. So President Trump, yeah. I know President Trump is working on that caravan morning, noon, and night, so I hope if he gets a minute to listen to us today, take it from New Jersey. When you uphold the principles of the Affordable Care Act, you end up with more affordable health care, period. And to help achieve our shared goals, I am so excited to announce our new Get Covered New Jersey program. We are more focused than ever on making sure residents know about their options, including that financial help is available to many. Today, we're going live with a new website, getcovered.nj.gov. Again, that's getcovered.nj.gov, where residents can learn more about the health insurance options available to them and start on their path to getting covered. Getcovered.nj.gov is also a vital toolkit for you, and we will also provide you with ideas to help you spread the word and encourage residents to find a health plan that's right for them and their families. With your continued outreach and support, we can help as many New Jerseyans as possible find the health care coverage they need. We are going to prove that working together, we will protect New Jersey. Enrollment opens in 2 days. Then we will all be working hard for 6 weeks to enroll as many people as possible right up to midnight on December 15. We are going to show that the ACA works. We're going to send a strong message to President Trump and to everyone who wants to undermine, subvert, and destroy the Affordable Care Act. By working together, I know we're going to win this fight. Thank you for all you are doing, folks, to keep New Jersey covered. I thank the leaders who have been part of this effort, including, they're not here, but I want to give a shout out to Senator Joe Vitale and Assemblyman John McKeon in particular, for our federal delegation represented so extraordinarily by Senator Menendez and Congresswoman Bonnie Watson-Coleman today, but the whole team, or most of the team, I should say, New Jersey Citizen Action, and so many other organizations. It is now my pleasure and honor to introduce one of the Senate's leading fighters to protect the ACA, the senior senator from the great state of New Jersey, the one and only Senator Bob Menendez.
Thank you, Governor. It's great to be here. What a difference a governor can make. As someone who was one of the authors of the Affordable Care Act sitting on the Senate Finance Committee, it pained me to see that our state did not have its official family behind the efforts to ultimately bring more people health insurance. I'm proud that the Affordable Care Act brought nearly 1 million New Jerseyans health insurance who didn't have it, protected 3.8 million New Jerseyans who have a pre-existing condition, some illness that they contracted during life or some birth defect, from being discriminated against, and so much more. And yet we could have had a lot more people if we had the full force of the governor's office and the administration behind us. Well, that changes today, and Governor, many people are going to sign up, are going to be eternally grateful for what you and your cabinet are doing. So thank you very much for what you're doing today. I appreciate it. I appreciate being here with my colleague in the House of Representatives. You know, Bonnie Watson-Coleman, if you're in a fight, you want her on your side in that fight, because she kicks butt, let me tell you. And she's kicking the butt out of cancer as well. And Bonnie, we are so glad to see you and see you so well as well. So thank you very much. Appreciate the First Lady, who's just been an extraordinary First Lady for our state, actively engaged, making a difference in people's lives. So thank you, Tammy, for all you're doing in our state. And to all of the distinguished cabinet members and my dear friends at Citizen Action, who I work with in so many different ways, from financial security to mortgage availability and to health care. Maura, thank you for your leadership with the Citizen Action as well in bringing us all together. You know, I had hoped that we would be over the fights about repealing the Affordable Care Act. I thought that we could finally get to improving it, building it. I never thought it was a perfect law, but it was a foundational law to change the nature of health care in our country, to make it not only more affordable and accessible, but also to move from a disease-based system to a preventative-based system. But insurance, at the end of the day, is about spreading the risk, having the widest pool available to spread that risk. That means many more people signing up, and it means a lot of difference in people's lives at the end of the day. At a time in which I had thought we had been over those battles, the administration is making everything worse. They're driving up the cost of health care by not, for example, using the cost-sharing provisions of the law to ultimately keep rates down, high-risk pools, and so much more. This occasion in which we are trying to get more New Jerseyans enrolled is so critical because at a time in which the administration cut back on the assistance to create more robust enrollment periods, the state's leadership and the governor's leadership here is extraordinarily important. It's amazing that although I hear colleagues and others talk about wanting to make sure that pre-existing condition discrimination, which we eliminated under the Affordable Care Act, is preserved, the administration is in a federal court arguing that the entire law is unconstitutional. So those million New Jerseyans, the 3.8 million who can't be discriminated against, women who cannot be discriminated against and charged twice as much as their male counterparts simply because they are women, being pregnant as a pre-existing condition, no more lifetime caps, keeping our children on to the age of 26, all those things that we did under the Affordable Care Act are under threat as we speak. And so I think the more people that we sign up, the more difficult it is to make that threat a reality. But that's our national debate that we are taking on today. I saw what we did in Medicaid expansion. I've met so many individuals and people who are facing, families who are facing the opioid addiction issue, who in fact the Medicaid expansion created an opportunity for them to try to get the help and beat the addiction at the end of the day. I saw how many New Jerseyans who are among the working poor, individuals who get up every day, go to work, some of the toughest jobs in our state, but they don't get health care at work, they don't make enough money to afford health care. Well, the expansion of Medicaid under the Affordable Care Act was extraordinarily important to so many New Jerseyans who got health care as a result of it. I met with cancer survivors who rely on the federal protections against pre-existing conditions. I met with self-employed New Jerseyans who, thanks to the ACA's tax credits, are able to purchase coverage on the marketplace. And to have a baseline of guarantees, no matter what your insurance is, like visits to specialists, coverage for prenatal and maternity care, mental illness and substance abuse, and so much more. I'll close by saying I rejoice that we finally have a governor who's helping us in working with all of you to get more New Jerseyans covered, but we still have a battle in Washington. One, on the repeal efforts. Two, on trying to cap Medicaid for the first time. That would end Medicaid as we know it. All the expansion that we talked about, if you cap Medicaid, one of the most significant institutes, the Urban Institute, says that's a $31 billion hit to the state of New Jersey alone. $31 billion. How do we meet the challenges of health care needs in our state if we cap Medicaid? All to give $2 trillion to the wealthiest people in the nation. I just don't understand how you can be a public servant and think that that's in the public service of the nation. So, Governor, we're so thankful to you. And now, the lady who I am so pleased to have as my ally in the House of Representatives, who takes no prisoners, Congresswoman Bonnie Watson called me.
Yeah.
Thank you, Senator. I'm always honored to follow the senator, our senior senator from the state of New Jersey. He's just been such a champion for all of us working families, women, immigrants, and I just look so forward to continuing to serve with him when we're in the majority.
Hey, here.
I am, and the Senate can be also. I'm always pleased to be around this governor and this First Lady because they walk the walk, they talk the talk and walk the walk. And today they have every commissioner that could make it easier for individuals to learn what rights they have and how they can become covered under the Affordable Care Act. So even from the insurance commissioner to human services to children and family services to health services and to the person who has the purse strings in the state of New Jersey, the treasurer, because whenever the administration agrees to do something, there is a cost associated with that. So this administration has everyone here that would touch those individuals who need to know that open enrollment is coming up. And that even though the administration and the Congress, Republican-controlled Congress, have doing everything they can to eliminate access to affordable care, to reduce the kind of care that will be available, and to even shorten the enrollment period, and to black out how people can even find out that there is an enrollment period. This administration is doing what it can for the citizens of the state of New Jersey to ensure that they know that this is still the law and that they still can be covered. And I'm grateful to be a part of Citizen Action because Citizen Action is exactly what it says, what it's called. Whenever there is an cost upon the citizens of the state of New Jersey, Citizen Action gets into gear and calls us together and makes sure that we are represented and we are standing and speaking the way that we need to. I'm glad to see that you are here because the more education you have about what is the law, what is happening, what could threaten the law, the more you're able to help the people that you care about because each one of you here represents a constituency that you touch. So together, we will ensure that the Affordable Care Act is extended to those who are qualified for it, that there is indeed an Affordable Care Act, and that come November the 6th, And then again on January the 3rd, or whatever that magical day is going to be, we will have people in Congress who will fight like the dickens to make sure that everybody has the right to affordable health care. It is not a privilege. It is a right. And I don't want to fight with anybody about what you do with the Cadillac insurance policy. If the Cadillac insurance policy is a good policy, then that should be the standard in the United States of America, not something we try to dummy down. So I thank you for the opportunity to speak on behalf of those whose voices and needs would not be met if we weren't all coming together. Thank you, and God bless you.
Well said. Well said. So well said. I mentioned earlier, honored to have the Commissioner of the Department of Banking and Insurance to say a few words, Marlene Curry. Marlene?
Good afternoon, everyone. Governor Murphy, our distinguished guests, Mara, and of course, everyone that is here today. In January, we know that our governor signed Executive Order Number 4 to ensure that New Jersey protected the Affordable Care Act and provide information to the public about options available for health care coverage. We took that directive seriously and worked with our colleagues to make sure that we, across the departments, worked on both policy and strategies to make sure residents could access the health care coverage they needed. At Dobie, that work included the preparation for and the implementation of the reinsurance program, and as mentioned by the governor, it led to a 9.3% overall reduction in health insurance rates. This work was critical to combat the Trump administration, whose actions to undermine the ACA has left states with no other choice but to take the lead in ensuring the protections provided by the ACA are maintained and that the residents have access to quality health care. That is why today's announcement is so important. Open enrollment begins on Thursday, and for the first time since the implementation of the ACA, New Jersey is all in. We will work to promote the open enrollment period and make sure that residents have the information about the options and the financial assistance that is available to them. Because of the chaos in Washington, D.C., and our state's refusal to act in prior years, enrollment in the individual market dropped 10% last year. Sadly, too many people were unaware that financial help was available. I am here to tell you today that last year, 8 out of 10 residents who purchased coverage on the marketplace in our state received financial assistance. We want people to know that if you qualify, financial help is available. Some of you may be thinking, or you might be asked, I don't qualify. Well, the truth of the matter is, this year, we have new lower cost options available. I encourage all of you to go on our website, getcovered.nj.gov. We know that there are residents who qualify for financial assistance but are not enrolled. This is not acceptable, especially when residents could have no-cost coverage health plans or coverage for under $100 a month. Thankfully, we have a governor who is taking a stand to support and promote the ACA and to ensure that our residents in New Jersey know their options. Let me repeat, the state is now involved. There are members of organizations in this room that have been the boots on the ground, helping to get the word out and to connect people to coverage. We are grateful for the work that you have done and will continue to do. You are not alone on this mission. We are here today to say that the state of New Jersey will join you in this critical effort. We are proud to launch the Get Covered New Jersey Public Awareness Campaign. This is a coordinated state effort to promote awareness of the options available so that residents can educate themselves, get available financial assistance, and choose the plan that works best for them. from distributing information at Motor Vehicle Commission locations to providing information on tax forms and in health settings, we will ensure that departments and agencies that interact with the public are directed to our website and to the navigators who can provide in-person help to residents seeking coverage. In addition, we will be working with community organizations, including our navigators, to get the word out. We are also providing printable material on our website that can be utilized by those doing the work in the community to support the effort. We are excited to partner with you, and we are asking all of you to go to our website, print the materials that you can find on the resource site, and get the word out about the open enrollment period. For the next 6 weeks, hand out flyers, hang them up in your community centers, tell your family and friends that financial help is available. Most of all, tell them to get covered. Thank you.
Well said. Well said. So well said. Thank you, Marlene. Really well done. It is now my honor to ask one more person to come up and say a few words, another extraordinary commissioner, Carol Johnson. Carol?
Thank you, Governor Murphy, the First Lady, Senator Menendez, Congresswoman Watson-Coleman, and Maura and Citizen Action for organizing today's event. But especially I want to thank the volunteers and advocates here today who will lead the charge over the next several weeks in getting New Jerseyans enrolled in affordable coverage. This is a great day for New Jersey. Despite all the heated rhetoric in Washington and attempts to undermine the law, we're kicking off open enrollment in our state with premiums that have declined nearly 10% this year. And as a person who spent more than 5.5 years of my life working in the Obama White House on the Affordable Care Act, I am delighted to be part of the Murphy administration continuing this fight. Governor Murphy has shown time and time again that he's committed to protecting the gains we've made under the Affordable Care Act, including affordable coverage through the marketplace and Medicaid expansion, and protections for pre-existing conditions. Where pre-existing conditions are threatened, we're fighting back in court. Where affordability is threatened, we're responding with new laws signed by the governor that help us get lower premiums this year. And where outreach enrollment efforts have been threatened by a shorter enrollment period and funding cuts to the assisters who help people with enrollment, we're responding as well. That's why Governor Murphy's executive order charged all of us across the stage and across the government with supporting outreach and enrollment. And that's why, as part of our new Get Covered NJ initiative, we're providing $375,000 in funding and support to 5 community organizations that served as navigators to help New Jerseyans with enrollment in Medicaid expansion and marketplace coverage.
Yeah.
As you all know, these are the folks who help consumers look for and understand their health coverage option, complete eligibility forms, and get enrolled. The Department of Human Services has awarded each of 5 organizations $75,000 to support these enrollment efforts. And we in the department are providing training, materials, and technical assistance to support enrollment. The organizations we're funding include the Center for Family Services of Camden, the Family Resource Network of Hamilton in Mercer County, the Orange's ACA Navigator Project, Fulfill Monmouth and Ocean of Neptune and Toms River, and the Urban League of Hudson County. We're really looking forward to working with these organizations. We've started our work, and we look forward to working with these organizations hand in glove and with those of you in this room over the next several weeks to bolster our enrollment efforts, spread the word, and get as many people signed up as possible. New Jerseyans should have as much opportunity as possible to learn about affordable coverage options and how coverage can benefit their families. It's the right thing to do because a healthy New Jersey means a better New Jersey for everyone. So I thank all of you for your efforts. Now, let's go get covered, New Jersey.
So well done. Thank you. Thank you. You know, Carol reminded me something that I should have said in my introduction of her. I mentioned that Senator Menendez was one of the authors of the Affordable Care Act in Congress. Carol, in many respects, was one of the authors in the administration, and it's where we actually first bonded, was really on health care and the Affordable Care Act when we met. And so thank you for everything you have done and what you're doing now. I think we're going to take a couple of questions from the press, who are, I believe, are largely on stage right here. Anybody? Please. I think the total is $450,000. Is that right? And that's been contributed to from across the departments represented here today. And it is largely, it's the public service piece, the outreach is going to be largely digital. Have I got that right, everybody? Come on now, Joe.
So Marlene, you'll correct me here. That's in addition to what we're contributing to navigators, correct? So that's
okay. Thank you. Just picking the pencil up here. Mike. Yeah, there isn't a goal, but we bemoan the fact, I think Marlene mentioned this, that last year the combination of the prior administration not playing the role that we're playing and President Trump and all that is going on with Congress, the enrollment dropped by about 10%. So I don't have a goal, but I'd love to be able to say conceptually, or at least in general, that we turned that needle back the other way and we made up some ground. Too early to tell because we've never done this before, so I don't want to marry myself to a number. Please.
Off topic. NJ Transit commuters last night, they say that incident only increases their everyday anxiety.
Yep.
Because the system just doesn't work.
Yep.
They want to know what's being done to improve the rescue operation
Yep.
and overcrowding.
So I know only in general terms what happened last night, but it's completely unacceptable. And they're incredibly frustrated, and so am I. We are making a lot of progress. There's no question about it. We are cracking through the positive train control requirement, which we have to get to in the next 2 months, and we will get there. We've got the right management in place. They've now got the funding they need. But incidents like this drive people crazy, and it drives me crazy. In particular, I believe they were sitting there for 90 minutes, if I'm not mistaken, and there's no excuse for that. So I don't have a specific forensic answer to that question in terms of exactly what happened, but the notion of getting people, if there is a problem, getting them off the damn train into a safer place, and particularly a place that's moving that's safe, is a huge objective of ours. Please. Senator Menendez.
I'll be happy to answer you. I don't want to detract from this. I'll be happy to answer you afterwards.
Okay. Please. English and Spanish. Yes. Paul, what an honor. You're so good to me. I'm very happy to see you. Yeah, I don't think that we're going to get in. Is that something, unless you have a great appetite to get into the middle of that? I think we'll take a pass on that, Paul. Thank you. Nice try, though. Dustin.
Do you have access to receipts, invoices, some sort of documentation for all the consulting firms that you have during the campaign, particularly Green Consulting? And if so, we make those public.
Do I have access to them personally? I don't know that I've seen them, but we stand on the side of transparency. I'm not sure exactly what that gets to, but we would release whatever we're required to release. I think we've released. I think we've been quite transparent. Charlie?
A letter from some of your supporters the other day kind of implied that or raised concerns that this upcoming legislative hearing or investigation is politically motivated or an attempt to score political points at your, not on your behalf, but I guess but to do harm to you, political harm to you, to bring
Yeah. I don't want to get off of what is a great reason to get together today, but let me just say this. Nick asked me a similar question yesterday. I have complete respect for the processes that we've put in place, most importantly. And that's an investigation as to what the heck happened, a comprehensive review of government policies and procedures, and then even more importantly, that's the second one led by Mamta Patel, the first led by a former Supreme Court Justice, and most importantly, I think, led by the Attorney General, a holistic review of our society. How do we make New Jersey best in class for survivors? As awful as that might be, survivors are too often not heard, not believed, not able to achieve justice. I'm married to one of those survivors, in fact. So I have complete faith in those processes. We stand with survivors. We stand with what I've just said in terms of the environment we want in this state. And let's make sure we keep politics out of it. And that's what we're committed to. We'll do one more. Nick, please. Just one more. I don't. It doesn't need to be inevitable. It does not need to be inevitable. I hope it isn't. Before I go to Nick, how many more questions do you have, Charlie? I've said what I'm going to say. Please.
On the situation in Montague, are you concerned about it, and how do you hope to prevent this from happening again?
Clearly concerned. I was there myself. I'm going to ask Dr. Elnahal to come up and comment on it. This is obviously of deep concern to us. We've lost 9 young lives, and it is completely of complete concern and completely unacceptable. Sharif.
Thanks, Governor. To echo that, we're absolutely quite concerned. These outbreaks happen hundreds of times throughout the year, but to happen to a facility like this with the tragic outcomes we've seen has made us take aggressive steps in response. We're sending infection control training teams to every single facility like Wanacue included. We have somebody on site full-time from our department reporting back to us, making sure infection control protocols are being followed, and we will continue that till the end of the outbreak. Well, look, as the governor alluded to in our press conference last week, we have to look at the standards here themselves. The findings that were noticed in August were all not noticed again. They were resolved by the time we were there a week and a half ago. But this is an ongoing investigation. We don't have all the answers yet. And we will come out with our full results of the investigation at the conclusion of the outbreak.
I would just say also, most importantly, keep these kids, those who have lost and their families in your prayers. There are others who remain challenged. This is by definition, this particular adenovirus number 7 is particularly aggressive with folks who have weakened immune systems, in particular have respiratory issues. And by definition, you probably aren't in that facility if you don't have one of the above. So please keep everybody in your prayers. I want to thank Senator Menendez, Congresswoman Bonnie Watson-Coleman, the extraordinary members of Cabinet, the First Lady, Citizens Mara, thank you for Citizens Action, taking such a lead role, all the other organizations. This is a big 6 weeks ahead of us. I don't want to marry myself to a number, but I love a challenge. So let's all get out there together and make this happen. Thank you all.